Dementia is a progressive condition which affects memory, thinking, and daily functioning. Alzheimer's disease is the most common form of dementia. In India, there are more than 9 million older adults living with dementia. Even then, it is very often not recognized and often considered as normal for aging, and people don't seek help. And because of that, there is a delay in diagnosis, and very often they receive inadequate care. Hi, I am Dr. P.T. Sivakumar, Professor of Psychiatry and Head of the Geriatric Psychiatry Unit in the Department of Psychiatry, NIMHANS.
What are the early warning signs of dementia? How is it caused?
One of the early changes that happens is a person keeps forgetting the recent events, which again and again they keep asking. Or if they are not able to do some of the usual complex activities, for example, cooking or handling the finances or traveling independently or making important decisions. If these are happening on a consistent manner, one should consider this as a warning for dementia and not ignore it as a part of normal aging. Dementia is caused due to multiple reasons. One of the most common reason is brain degeneration. It may be due to some of the protein deposition called as amyloid proteins, or other specific disorders has other specific causes. One of the common cause is also because of blood supply getting affected for the brain.
What treatment or management strategies are available?
For dementia, the first and foremost approach is to identify any reversible causes like vitamin deficiency or any other problems in the brain. If that is evaluated and then the diagnosis is confirmed as a degenerative cause like Alzheimer's disease, the treatment approach is primarily symptomatic supportive care. With the help of some medications, the predominant form of support is through behavioral strategies. It also depends on the stage of dementia. For somebody with a mild dementia, more cognitive tasks and then supportive activities will be scheduled. For somebody with a moderate and severe stage of dementia, it is more of a rehabilitation wherein options like daycare or even somebody with a severe dementia and behavioral problems, rehabilitation services like even residential care can be considered to support the persons with dementia.
How can families provide meaningful care and support for someone with dementia?
Family caregivers like the children or the spouse, they are the most important partners in providing care for persons with dementia. They often require support for a long period of time, as this is a progressively worsening condition. The nature of support also varies according to the stage of dementia. In the initial stages, some assistance is required for more complex activities like traveling or managing the finances and ensuring the safety and supervision of the person with dementia. In people who have behavioral problems and people who have more advanced dementia, the nature of support will be more different. They have to provide continuous care and support. In all these things, they have to ensure that they provide support, but at the same time, they ensure the dignity and the well-being of the person with dementia, and they are treated in a respectful manner.
What are the strategies to prevent dementia?
Dementia can be prevented, or the onset can be significantly delayed by addressing important modifiable risk factors. There are common factors like diabetes, hypertension, dyslipidemia. These things, if it is controlled adequately, it can delay or prevent dementia. Also, ensuring regular physical activity, cognitive activity, and social engagement is an important tool contributing to prevention of dementia. We can actually help people live longer in a healthy manner by delaying and preventing dementia by addressing these important modifiable risk factors. Dementia due to degenerative conditions like Alzheimer's disease cannot be easily cured. Timely diagnosis, as well as appropriate treatment and support, and compassionate caregiving can make a big difference and ensure their good quality of life. Promoting awareness and reducing stigma can help in better care for those affected with dementia.